Hello. On behalf of my co-authors, we appreciate the opportunity to present. Unfortunately, 1 in 4 Americans experiences some degree of transportation insecurity annually. Despite the number of Americans affected, transportation insecurity is understudied compared to food or housing insecurity. I'd like to explain how transportation insecurity manifests as a social determinant of health. Transportation insecurity can cause lateness, spending a long time planning, waiting, or traveling, skipping trips, social isolation, and worrying about transportation. I think most of us in this room are familiar with lateness due to transportation problems. However, most research addressing transportation as a social determinant of health only considers distance or travel time, leaving us with a unidimensional understanding of a multidimensional problem. We hope to add to this body of work by considering 2 recognized but understudied manifestations of transportation insecurity: skipping essential trips and social isolation. Using data collected by the CDC, our goal is to establish the relationship between missing medical appointments and cancer screening in a nationally representative sample. Our hypotheses were, first, that transportation insecurity negatively predicts cancer screening. Second, that social support would positively predict cancer screening. Recognizing that asking others for a ride is the most common strategy to mitigate transportation insecurity, we hypothesized that social support moderates the relationship between transportation and cancer screening. Our data comes from the 2018 National Health Interview Survey. The National Health Interview Survey is an annual in-person cross-sectional survey conducted by the U.S. Census Bureau and the National Center for Health Statistics. The sample is representative of the non-institutionalized civilian population of the United States, and it is designed with stratification and clustering. Core questions are asked yearly, and rotating supplements are asked every 2 to 5 years. Our predictor and outcome variables of interest happen to align in the 2018 survey. In 2018, the household response rate was 64.2%, which yielded around 25,000 total respondents. Around 2% of the US population, or around 5.8 million people, have missed a medical appointment due to transportation issues. Among those overrepresented are women, adults without a partner, those with less education than a bachelor's degree, the racial and ethnic minoritized, including individuals identifying as non-Hispanic Black, and individuals who in the study were categorized as other, but this mainly includes Indigenous Americans. Additionally overrepresented are the unemployed, the uninsured, and those at the extremes of age. As you can see, these differences are statistically significant. To address our first hypothesis, we defined appropriate cancer screening according to the U.S. Preventative Services Task Force recommendations in effect during 2018, when this data was collected. Similarly, the population eligible was defined using the recommended age range for screening, as defined by the USPSTF. Transportation insecurity was a significant negative predictor of colorectal cancer screening in univariate analyses, but this association did not survive correction for sociodemographic characteristics. We did a sensitivity analysis to look at colonoscopy completion only, as FIT and stool DNA screening can both be done at home and returned by mail. The results were not different in the sensitivity analysis. In contrast, transportation insecurity was a significant negative predictor of breast cancer screening in the fully adjusted model. Here, the odds of getting screened for breast cancer decreased by 40% if participants reported missing any medical appointments due to transportation issues. Finally, transportation insecurity was a negative predictor of cervical cancer screening in a univariate model, but again did not survive adjustment for sociodemographic characteristics. Turning our attention to social support, we found that 17% of the US population reported that they had no one they could count on in their neighborhood. Disadvantaged subgroups were similarly overrepresented among those who lacked social support, with the notable differences that men and women equally reported low levels of social support, that widowers did report adequate social support, and that people identifying as Hispanic were not overrepresented among those with transportation insecurity, but were among those lacking social support. Again, with the exception of sex, there were significant differences among the population who reported low social support. Social support positively predicted colorectal cancer screening in both the univariate and fully adjusted models. Similarly, social support predicted breast cancer screening in both the univariate and fully adjusted models. Finally, social support predicted cervical cancer screening only in a univariate model, and the relationship did not persist when individual sociodemographic factors were accounted for. We observed no interactions between transportation insecurity and social support in relation to any cancer screening. In our analysis, we found that transportation insecurity negatively predicts cancer screening for breast cancer, but not colorectal or cervical cancer. That social support positively predicts breast and colorectal cancer screening, but not cervical cancer screening, and that there were no significant interactions between transportation insecurity and social support. These results lead to the following implications. First, in this national survey, only 2% of people reported missing medical appointments due to transportation, in contrast to work done with the American Community Survey that demonstrates that at least 25% of the population experiences some transportation insecurity. This suggests that the question asked in the NHIS is highly likely specific to transportation insecurity, but may not be sensitive enough to capture all people whose medical decision-making is influenced by unmet transportation needs. Second, we note that breast cancer was predicted by both transportation insecurity and social support. This raises the question of whether the demographic eligible for breast cancer screening, in this study, women 50 to 75, may be more susceptible to unmet social determinants of health. And then finally, while neighborhood social support positively predicts cancer screening in 2 of 3 cancers studied, the questions regarding social support were not informed by a conceptual understanding, and it remains unclear whether emotional support or material social support, like doing someone a favor, is driving the effect. Thank you, and I'm looking forward to your questions.